Hello, boys. Good afternoon. Uh, it's very good to have classes with you again. How is going everything? Hope everything is fine and you're all safe at your home. And at the same time, you're having very good preparation for your exams. And always try to cheer up yourself mentally, though you're staying home, but you're having much more time with your family members. You're getting so many times for your recreation type works, for your for spending time with your favorite hobbies, and at the same time you're getting enough time for preparing yourself for your exam or any kind of competition. And as we are continuing our class in on virtual based class, we are just trying to review our topics, our lectures again. And if you have problems, if you are facing any problems, you can share all problems with us. But try to make it in a continuous way. By getting disappointed, don't leave your hope, don't leave your study. And as you have another test, in-house test, that is going to be started very soon, so just get prepared for this test now. And your test examination, your finally board exam, everything will just be taken in time, so don't get disappointed. Just be ready for any kind of test. We were reviewing chapter 14, physics to save life. This chapter is mainly related to different kind of diagnosis element that are used to diagnose different kinds of severe diseases, and these are blessings to us. For this diagnosis element, we have become able to diagnose those diseases that were not able to detect earlier. So death rate has been reduced by this element. We just had a brief discussion on X-ray machine, on ultrasonogram, about CT scan, about MRI, and I will just start today's class with angiography. This is also a diagnostic element. Angiography is an imaging test that uses X-rays to review your body's blood vessels. These element or these diagnosis equipment is mainly used to examine our blood vessels. That means sometimes due to plaque, due to some obstacles, our blood vessels gets narrow. Our blood vessels become narrower, and or sometimes they gets blocked. So to diagnose such kind of problem, angiography is used. The X-ray is provided by an angiographer called angiograms. This test is used to study narrow, blocked, enlarged, or malformed arteries or veins in many parts of our body, including the brain, heart, abdomen, and legs. So these are severe parts of our body, for example, brain, heart. So if the blood circulation is collapsed to this element, a person just face so many problems for these collapse. So for identifying such kind of blockage, angiography is the best one. How the test is done, the procedure: to create the X-ray images, doctor will inject a liquid dye. Already you have known about dye. Dye means some contrast material that is used to diagnose the specific portion more clearly. So a liquid dye through a thin flexible tube that called a catheter. The doctor threads the catheter into the desired artery from an access point. The access point is usually in arm, but it can also be groin. That means through your arm or through the groin, the catheter is inserted into a patient's body for the test. Then the dye or the contrast material make the blood flowing inside the blood vessels visible on X-ray and shows any narrowed or blocked area or in blood vessels. That means dye makes it easier to observe the blood vessels in X-ray test or in X-ray machine. So use of dye just it makes it visible whether there are any blockage in a patient's vessel. The dye is later filtered by the kidney and passes out of the body with urine. So using a dye is not a matter of concern because it just gets filtered by the kidney and it just passes out through the urine of a patient. The whole procedure lasts approximately by 1 hour, but it may take longer if the treatment takes place in the same sitting. If the test is done and in the treatment is also done at a time, then the procedure takes much more time here. Angioplasty, we have known about angiogram. This is a test for finding any blockage or any kind of barrier, any kind of narrow blockage in a patient's vessel. That is called angiogram. What is angioplasty? And angioplasty is a minimal invasive technique to treat narrowing or blockages in the vessels that restrict the blood flow. This is done by passing a balloon across the diseased segment and then inflating it. The size of the balloon will match exactly the size of the blood vessel. As a result, the plug or the due to which the blockage was created, the plug will literally be squashed and against the vessel wall, restoring a good lumen that allows the free flow of blood. If we just look the pictures here or overview the diagrams here, this is just before an an angioplasty. This is the former diagram, former image before angioplasty, and this is the after image of an angioplasty. And there are two images here. This is the after image of angioplasty. This is also before angioplasty, and finally last picture is also after the angioplasty is done. That means here there was a blockage on first image, but this blockage is removed or the blood vessels get clear after angioplasty. This is the this is the motive of using the method angioplasty. Sometimes a stent, what is stent? A stent is a metal frame that is built specially for this kind of diagnosis or this kind of examination. Sometimes a stent, that is a metal frame, is inserted after angioplasty. A stent is a tube made of special metal and works like a scaffolding to assist keeping the artery open. That means as the for angioplasty, a balloon was used. By using the balloon, the blockage artery was made free, but after removing balloon, there gets some chance of creating blockage again on that artery or on that vessel. vessels. But if metal frame called stent is placed on that vessel, then the vessel won't get blocked again. So for this purpose, stent is used. If we just observe the diagram over here, the total procedure will get clear to us. The catheter on first diagram, the catheter is inserted here uh, through the uh, groin. Here the catheter is inserted through the groin, or it can be inserted through the arm of a patient. Then that catheter just moves to the blocked area of that patient. On this diagram you can just see here is a plug that is working like a barrier to the blood flow. There is a just binding or blockage due to plug, and then the catheter is passed through it, including a balloon that is called balloon catheter. And it also consists of a stent. So what is the function of stent? After inserting the balloon catheter, it is inflated, the balloon is inflated to expand the stent. The stent is also expanded over here. Then the balloon is deflated. That is, the balloon will be removed from here, but the stent will remain here permanently. Balloon is deflated, catheter is removed, but stent is remaining here to hold artery open. And though this is inserted from outside, the stent is inserted through a vessel from outside, and such kind of metal is chosen over here that is not harmful for a patient body. So this is the total procedure for an angiography or angioplasty, and we have just understood the process well, I hope so. Then we will just discuss about the endoscopy. What is endoscopy, or what do we mean by endoscopy? A flexible tube called an endoscope is used to view different parts of the digestive tract. Endoscopy is mainly used for digestive tract. The tube, that means the endoscope, it has a light and a camera at the one end. Images of the inside of the body are shown on a television screen. Using the light and the camera, images are taken from different angles, and those images are shown on a television screen. Doctors will often recommend endoscopy to evaluate different kind of symptoms or different kinds of problems. For example, stomach pain, ulcers, gastritis, or difficulty swallowing, digestive tract bleeding, changes in bowel habits, polyps or growths in the colon. So for this kind of problems, doctors specially recommend endoscopy. Procedure: the procedure is usually done while you are awake. That means if the patient is awakened, then the procedure starts. There is no need to make the patient sleepy. You may be given a local anesthetic to numb a specific area of your body, the area that will be tested. So here is a anesthetic procedure is used to numb the specific area. Then the endoscope, the tube will be carefully put into the body. It may be put into through mouth and down of throat, or by through bottom or anus. So when passed through the mouth, if the endoscope is just passed through the mouth, an endoscope can be used to examine the esophagus, the stomach, and some of the small intestine. I repeat here, when the endoscope is passed through the mouth, that is done to diagnose some special parts of our body, for example, esophagus, the stomach, and some of the small intestine. But when the endoscope is passed through the anus, then this is done to examine the rectum, anus, and the entire large intestine. Endoscope range in endoscope is a small tube. This range in diameter from about 1/4 inch to about ½ inch, and range in length from about 30.5 centimeters to 2 meters. This is a mm, standard measurement, but for the which portion of the body is used for diagnosis, on the based on that, the length of the endoscope is determined. With a lighting source and small camera, some endoscopes have ultrasound probes. Some endoscopes have only lighting source and camera, but some endoscopes have ultrasound probes. That probes just receives echoes and gives more details report. Many endoscopes are equipped with a small clipper, just like small scissor, with which tissue samples can be taken. That can be used for bioscopy. That can be used for biopsy or other testing. These samples can be evaluated for inflammation, infection, or cancer. So these are the common parts of endoscopy machine. Endoscopy for the process of endoscopy. Then if we just look the diagram over here, as we have stated earlier, we have learned earlier that endoscope can be inserted through the mouth or through the anus. Here, if the endoscope is inserted through the mouth, uh, the esophagus, the intestine are examined. But if the endoscope is just inserted through the anus, just this part of the diagram, the endoscope is inserted through the anus. That is done to test the anus, the rectum, the large intestine, etc. So according to the need, according to the demand, the doctors recommend which portion of the body, through which portion of the body the endoscope will be pushed or inserted. So I hope you have understood this diagram well. And after inserting the endoscope, the whatever are going on inside the body of a patient, that is observed on a monitor. A monitor is also used here to observe the total things. This is also another diagram of endoscopy. As I have told you, some endoscope include light and camera, but some endoscopes also uses light, camera, and a special tool, scissor-like tool or clamp, that is used to take tissues from the infected area. So this is that special tool or clamp like material that is used to take the infected tissues from the problem areas. These are the some points related to endoscopy that we have to remind. First of all, light undergoes through the tube by total internal reflection, as the body structure is not straight bodies. Our colon, our intestine, all parts are not straight, so we have to use such kind of material that can allow the light go through it. So for that, in endoscope tube, for total internal reflection, optical fibers are used. Optical fibers allows total internal reflection, and that's why they're just don't arise any problem of testing the infected areas. Before having any endoscopic procedure, a person must avoid food for 6 to 8 hours and avoid liquids for 2 to 4 hours before the procedure. That means before going for the endoscopic test, a patient must avoid food, leave food for 6 to 8 hours, and just leave liquids for 2 to 4 hours. Endoscope can also be used for treatment. Not This can be used not only for diagnosis purpose. This can also be used for treatment. For example, a doctor can pass different types instrument through a small channel in the endoscope, that can include an electric probe at the tip of the endoscope, can be used to destroy abnormal tissue, to remove small growths, etc. A needle at the tip can be used to inject drugs into dilated veins in the esophagus and stop their bleeding. So endoscope can also be used for treatment purpose. That means this can be used for destroying any kind of abnormal tissue, and this can also be used to insert any kind of drugs to the infected area. So these are all details about two diagnosis element. One was angiography and endoscopy. If we just have first knowledge about this element, then we will just don't get feared if anytime doctors just prescribe us for any kind of test. And we also tell our friends or relative in details about this test, so that they don't get frightened before doing the test. I hope all of you have understood the words and the procedure as well. So keep studying and stay safe, and just continue your regular work. Goodbye, everybody. Take care.